I'm Dr. Durgaprasad Reddy, Professor and Head of the Department, Cardiac Surgery at VIMSRC Hospital. Pacemaker, position, purpose and procedure. So when you talk about position, mostly it is RV, right ventricular lead placement. Usually it's done in the apex of the right ventricle, traditionally. But due to the latest trends, what some people are doing is to place the leads in the septum, or you have to place the leads in the right ventricular outflow tract. And traditionally the RVA leads are placed in the right atrial appendage. And when you're talking about the purpose, it can be because of the various degrees of heart blocks, or whether the patient is having severe bradycardia where the heart rate is very low, or bradytachycardia. Means sometimes the patient is having tachycardia and sometimes the patient is having bradycardia. That means fast heart rate and a low heart rate. So these are the conditions where pacemaker is applicable for patients. Procedure is usually we enter just below the clavicle. We select one of the veins. After all the sterile procedures with all hemodynamics monitoring, the patient is kept in a very sterile condition in a cath lab. It's performed, and we always insert a lead into the RV. Usually the sheath is inserted below the collarbone, a vein which is probably a subclavian vein. A sheath introducer is introduced into the vein, and then the lead is passed through the sheath, and it is with the help of the fluoro, cath lab fluoro, you place the lead in the RV, apex or the septum or the RVOT, and that lead is connected to a generator which is slipped into the pocket below the clavicle, and it is slipped and it is placed there, and make sure the pacemaker is working continuously. We place the generator on the opposite side of the dominant hand.